Patients with diabetes have to take a lot of blood glucose readings, and those blood glucose readings are there so that they can guide their treatment, particularly when they're on insulin, so that they can change the doses of insulin they need and perhaps take sugar or carbohydrates, which are starchy foods, in order to regulate the blood glucose. And we as healthcare providers, doctors and nurses, want to support them in doing that, but we need that information.
My name's Ken McVicker, I'm aged 55. I'm a driving instructor with Police Scotland. I'm a diabetic, type 2, and it's treated with insulin. Well, I'm a driving instructor with Police Scotland. Obviously it's very, very important to them that my sugar levels are kept under a strict control, obviously the type of work we do. The DVLA also are very, very interested in what you're doing, which again has a lot of restrictions on it whenever you're coming to driving regarding sugar levels, so to be checked every 2 hours. It's very, very important that that's done. The ability to monitor the sugar level has improved so much, and it has improved remarkably over the last few years. The more accurate your readings are, the more you can control the condition.
Well, DiaSend is a system where no matter what the meter is, you can upload the results on your own computer at home before you come to clinic, or you can bring your meter in and upload all the information so you can see it all in one easy to use, easy to understand screen on your computer, and look at those together and look at averages and percentages and where the patterns are and discuss them. Really, the bottom line for a patient with diabetes is you're trying to keep their blood glucose controlled, and you're trying to stop it from going too low, because when it goes too low it can make them feel unwell, and you want to stop it from going too high, because if it goes too high it can cause complications and also make them feel unwell. Yeah, well, I think one of the problems with the traditional system is that it was very bitty. You'd have patients sometimes writing blood glucose readings down in a book or on a sheet of paper or in a journal or on the back of, hopefully not a cigarette packet, but on the back of an envelope, and then bringing it into the clinic. And then of course the problem is that if you're confronted with a lot of bits of paper with numbers written on them, you can't really find patterns. Patients love this system because they can come with information that they've taken a lot of time and effort to gather and get use out of it. So they really feel now empowered that they're leaving with the information they need and the training they need for what's actually happened to them. So I think that's the main difference I've seen, is that patient engagement and patient satisfaction with their interactions with the clinic are much better. Well, My Diabetes My Way is an online resource for the patient which does a couple of things. It lets the patient see the results that we take. Now, these are different from the blood glucose results that you take on a day-to-day basis for your management. These are things like your blood pressure, your weight, your cholesterol results, your kidney tests. And it allows patients to be able to review those and say, has my weight changed over the last 5 years? What's my blood pressure doing? And gives them some more ownership of that data, which is really useful, particularly if they're seeing other people like GPs and things, and they want to know what that information is and it hasn't been shared.
For My Diabetes, I think it's a very, very good thing for everyone, from the DVLA, my employer and the consultant, and more importantly, me, because I'm the one that has the condition. And once I leave the job and I retire, I'll still have the condition.